Oh yes, you're getting another backyard vlog. Sorry. I just need to make these videos. This is a medical and health update video, by the way, so if you're looking for weight loss, you can click out because it's, oh, there's a big hole in the ground. Okay, I just need to, film this and everything while it's fresh in my mind, because I have a terrible memory, especially for like times, dates and times. And this is a really good way for me to keep track of everything, symptoms and appointments and all that. So I just got back, just this second, from seeing my new rheumatologist, and it was really good. He's super nice. Sorry, I know. This dog, man, I'm sorry. Okay, so I just saw the new rheumatologist. He's super nice. He really sat there and took the time and talked to me and kept saying, what else? Which is awesome, because my last handful of doctors and specialists have just been like shutting me down as soon as I start to give them the what else, because I always go in with a long list and then I only get through like one thing because I feel rushed and in the way. So I like that he did not make me feel that way. The gist of it is, he's not totally sure that he agrees with the diagnosis I've been given, which is mixed connective tissue disease. He thinks that it may actually not just be, but it may be lupus. I say just lupus because mixed connective tissue disease is a mixture of lupus and other things. It does change, sort of changes how the lupus presents, whether you have just lupus or a specific type of lupus versus the mixed connective tissue disease. But he is going to do some more tests. So, yeah, so that's interesting. He didn't come right out and say, like, you don't have mixed connective tissue disease. He just sort of said it's very interesting. And that he thinks it presents itself a little bit more like a traditional systematic lupus. Systemic is the word, not systematic, sorry. Come on, Z. Sorry, I'm inside now. Less distractions, more sweat. Sorry. So, okay. So his first step is to try and narrow down if I definitely have mixed connective tissue disease or if it's lupus. And he really wants me to see a nephrologist, which is like a kidney specialist, which I sort of wanted to do back in the beginning when I thought that it was lupus. I just kept going back to my primary care doctor and asking her if my kidneys were okay, because I had to wait so long to see a rheumatologist and to get a diagnosis, that I wanted to confirm that my kidneys weren't failing in any way. And, he looked at all of my blood work and my urinalysis and all the tests that I've had done. And he just was like, it's clear that you're still very much in active disease, which means like whatever it is still flaring up. It's still active, and the medication that I've been taking has helped. I know it has helped. I feel it. But he said it's certainly not helping enough, because the active disease should be in remission it shouldn't be in a flare-up all the time. So interesting. He mentioned a couple other prescriptions, medications that we could try. Methotrexate is one, which my previous rheumatologist had mentioned. And the only real downside to that is that it could mess up your liver, so you have to take folic acid with it, and you cannot get pregnant. And I have no plans of getting pregnant, not now or in the future, so that's totally fine with me. He did not prescribe it just yet. I think we're going to try and make sure that my kidneys and liver are already okay enough to do that. And then the next step would be another medication, and that one is an infusion, so it would be like an IV medication. That's further down the line. So overall, really good appointment. I feel really good about it. I'm glad that they're going to do more tests, and I will go, I think I'll get those tests done, probably next week. But then I'll go back and see him in 3 months. So in November, I will see him again, unless anything happens. And he was like, just call me. He's like, you're the patient. I'm here for you. Just call me. And I was like, sir, I love you. So, yeah, so good. I feel good. This doctor is also even closer to my house. It's literally like 1.5 miles down the street, which is amazing. Yeah, it's good. So next up is next week I go back to the hand specialist to tell her that the cortisone shot did me no good. But I think that if she recommends surgery, I'm definitely gonna say let's wait, because this doctor kind of confirmed what my thought is that even if it is specifically carpal tunnel syndrome, that it's being caused by and exacerbated by the inflammation levels in my body. And I had asked my previous rheumatologist if that were the case, and he just said, oh no, I don't think so, go see a hand specialist. But this guy said, yeah, of course, carpal tunnel it's literally caused by inflammation pushing on the nerve. So if I have chronic inflammation, why wouldn't it be caused by that? So yeah, so I'm definitely gonna wait on any serious treatment for that, because there's a good chance, he said, that the methotrexate, if I start that, and or the infusion, that it could really help me to start feeling better within 1 to 2 months, he said. So yeah, so that's my update. I'm sorry it was all over the place. If you actually sat through it, thank you if you did. It's obviously mostly for me to keep track of this whole journey of health. And yeah, so that's it for now. I'll talk to you again soon. Bye.